Good evening, Bermuda, and welcome to this very special panel presentation that we have for you tonight on the topic of mental health in Bermuda. Since the pandemic hit our shores and impacted all of us, we have likely discussed, or at least tapped into, our emotional and mental health well-being, now more than ever. In addition, another reminder about the crisis of human and social injustice in our world has hit us hard in recent days. So these challenging times often bring about feelings such as anger, frustration, pain, sadness, hopelessness, and others. Bermuda, we need to talk about this. Tonight's esteemed panelists are here from across the third, public, and private sectors of Bermuda. They will be speaking on the trends that they see in their areas of mental health in Bermuda. They will provide everyday coping tips that can help any one of us to cope better in our everyday life. And they will also talk about the red flags for when you need to reach out for more help other than what you may be doing on your own or in your own family and social circles. With that, I would like to welcome our panelists and tell you a little bit about what they're going to be speaking on. Tonight we have Rishee Paschal, a senior counselor at Family Center, who will be talking about child, adolescent, and family mental health. We have Dr. Gemma Harris, a senior clinical psychologist at Solstice, who will be talking about general adult mental health matters. We have Tawanna Wedderburn, the clinical director of mental health services at MWI, who will be talking about couples matters and carers of persons diagnosed with COVID-19. Followed by Dr. Cherita Rayner, a clinical psychologist at Mid-Atlantic Wellness Institute, who will be talking about persons with addictions and matters in that area. And finally, we have Aria Bean of EAP Bermuda, who will be talking about employer-employee relations during this time. So with that, I'm going to go to our first question for the panelists. So Rishee, can you please tell us about the mental health trends that you are seeing in child, adolescent, and family mental health in Bermuda?
Most definitely. Prior to COVID-19, our children are already dealing with various situations with school, with peers, with families. And amidst all of that, they're trying to find their way in identifying emotions, understanding their emotions, coping with them, and being able to manage their behaviors as it relates to the situations that they're in. On top of that, we have their parents who are also trying to manage themselves and their daily issues that they may face and challenges that may arise. And they're also trying to manage their children, manage their behaviors, understand their emotions. So in addition to that, now we have COVID-19, which has totally turned us all around and shifted us as a whole. Parents are now shifting in their work buildings and having to now be a parent and a teacher. Children are having to adjust from a structural setting of a brick and mortar going to school to now home being school. So that is also something that our parents are dealing with and our children are dealing with. And in addition to all these transitions and adjustments, there's also the financial concerns that may come up and arise as we adjust and figure out what is all happening with COVID-19. And with all these things coming up, it raises emotions for our parents, emotions for our children, emotions that everyone has to understand, identify, cope with, and be able to move through. As Sandy mentioned, we also have COVID-19 and then the injustices that are happening around the world that we're also kind of seeing here in Bermuda as well, which is the racism. So Bermudians, mainly Black Bermudians, are specifically trying to manage the emotions as it relates to these injustices towards them and the trauma of the racism that they have been experiencing. And with that, they are highlighting what's occurring in the U.S., and Black Bermudians are also faced with the need to manage these emotions while explaining and empowering their Black Bermudian children, despite of all the injustices that they're facing. So that's just, I want to say, the tip of the iceberg of what we're dealing with when it comes to the mental health challenges for our children, adolescents, and our families.
Thank you, Rishee. And now on to adult mental health matters. We have Gemma here.
Thank you. Yes, Sandy, we're noticing a huge spike in referrals in the private sector. And I guess that's partly because, actually there is a lot of heightened stress at the moment, a lot of challenges in terms of adapting to changing circumstances, uncertainty, I guess, you know, for the majority of the time we're thinking about this as a normal response to an abnormal situation. And for many people, you know, it's kind of common for people to be experiencing some sort of difficulties in adapting. One of the areas, I guess, that we are seeing a lot more of is anxiety, problems with anxiety. And I guess that's partly related to our threat system being activated. Obviously, this is COVID-19 is a obvious stressor for people, and what we're noticing is that people's threat system is activated, but which is a healthy thing. We understand that that's an important part of being human. But what happens when that threat system is activated for any protracted period of time or with any intensity is that people are struggling to manage that on a day-to-day basis. I also feel like the number of changes that people are experiencing is often also linked to isolation and depression, and so we're seeing an increase in that. I mean, I think for people that are out there in the public right now thinking about how to manage their mental health, it's really about recognizing, you know, if you can, the normal sort of response to this abnormal situation, but sort of thinking about a couple of things to think about is the intensity and the frequency of symptoms. So if people out there listening feel like they're noticing that they are more preoccupied with their worries, there's more rumination, if they feel like there's an impact on their daily living, maybe sleep is affected, maybe they're noticing a lot more changes in mood, I guess social withdrawal, and then if they're resorting to any unhealthy coping strategies like substance use or shopping or things like that, excessive things that maybe have consequences later down the line, they might be reasons to sort of think about whether extra help might be needed.
Thank you, Gemma. And with that, of course, with adults, they're in relationships. And so we've got Tawanna here to talk about both carers of individuals with COVID-19 and couples. So Tawanna, if you can share some trends that you're seeing in these important areas, please.
Sure. Before I get into some of the trends for couples, Sandy, I wonder if I could speak about some of the trends that we're seeing in the hospital setting as it relates to mental health. Particularly, we've seen an increase in our helpline number calls. For example, in March, we saw 77 calls to our general helpline number, and by May, we are receiving about 126 calls. We are seeing a similar trend with our suicide crisis line, where in March we saw no one calling, and by May we received 5 calls. So that trend is quite interesting. The other trend that we are seeing is an increase in risk assessments for children and adolescents, and that's particularly the case in the last 3 weeks. Interestingly, we have seen a reduction in the number of admissions to our inpatient services. However, we are seeing an increase in the number of new admissions, and that's primarily for people who have not had contact with mental health services previously. And this increase tends to be related to COVID-19 itself, relationship issues, persons dealing with lack of income, and some uncertainty around what will happen as a result of COVID-19. On the healthy side of the trends that we're seeing, there are 3 things I would like to mention. One, we've seen an increase in compliance with persons taking their medication. In addition, we've seen an increase in the compliance with persons following up on their appointments. And for those clients who have autism and other intellectual disabilities, we are seeing that they are quite enjoying the social distancing. And so shelter in place has worked very, very well for them. So these are some of the things that we're seeing in the hospital setting in particular.
Thank you, Tawanna. If you can actually also share, are there any specific trends when it comes to relationships with adults?
Yes, Sandy, we are seeing, as I mentioned, because we are seeing an increase in some of our admissions, and some of that is related to relationship issues, we are seeing that couples are having some challenges interacting with each other and spending a lot of time with each other. And it doesn't matter the kind of couple, and I say the kind of couple because we have senior couples, i.e. people who have been in relationships for 20, 30, sometimes 50 years. We have persons who are newlywed and just entering into relationships. We have people within our LGBTQ plus community who are also navigating their relationships and being in the same household more often than not. And then we have people who I call a little bit seasoned, meaning they are married for a little bit longer than about 5 or so years, but they are also having to learn things about each other in a home setting. And of course, later on, we'll get into some advice that we have for some of our couples as a result. For our carers, we are seeing that they are challenged trying to balance caring for a loved one that has COVID-19. And they have their own anxieties and they really want to be there. And there's a lot of fear and worry around what will happen to my loved one. And so again, we have some great advice for those persons during our broadcast this evening.
Thank you so much, Tawanna. I mean, there's certainly a lot to digest here. And one really important area that doesn't get talked about enough is often addictions, because they are often become individual secrets or family secrets. And so I'm so pleased that Cherita is here to talk about, individuals who are going through challenges with addictions and substance use.
Thank you. Definitely within addiction treatment, we've seen some changes in the way services are provided during this time, but each service remains committed to providing the best that they can for our clients. And I have to take this moment to commend our Turning Point clinicians for their ability to strive to meet our clients' needs and conduct telephone sessions so that we can continue to provide these services. Within Turning Point specifically, we've seen an increase in referrals to our service and people requesting treatment services, particularly within our detoxification and medical assisted services. And it's really interesting when we look at why this might be. For some, it may be that this period of being at home has made people more aware of their substance use, or they may have identified some worrying trends in their substance use. And for others, it may be that due to our borders being closed, we actually don't have incoming illicit substances. And so people may be experiencing withdrawal symptoms in that context of not being able to access the substances they would normally use. And so we're looking at these two factors as being reasons why we're seeing this increase in requests for services.
Thank you, Cherita. And then another major topic, as so many people have been working from home, is employer-employee relations, and where is the balance between working from home and maybe one's personal life? And so we're going to give that question to Aria Bean.
Thank you very much, Sandy. So what we recognized at EAP Bermuda is that the work-life balance is more blurred than it has ever been before due to the COVID pandemic. So for those of us who have the opportunity to work remotely, we're trying to negotiate how to be good employees, how to be good persons in the home, how to be good parents, good spouses, how to be good partners, how to be good caregivers for any additional persons that we may have in the home, a whole host of things. Some of us are easily wearing 3 to 4 different hats on a daily basis, and each of those hats comes with its own set of pressures. So at this point, we are finding that there are some organizations who are responding beautifully to this process and are responsible and caring with their employees. But there are others who are still expecting the same level of output from people as if their normal life isn't happening or if it isn't as important. And that's where we see organizations and their employees starting to really struggle in their relationships. So a bit later on, we'll start to talk about what those red flags look like, as well as the coping skills for those employee-employer relationships.
Perfect. Thank you, Aria. And so with that, actually, what we're going to do is just go back around to each panelist and talk about what are some of the everyday coping skills that our listening audience can take on. Again, whether you are an individual or as part of your relationships or as a family unit. And so we're going to begin with Rishee again to talk about everyday coping skills for families.
Everyday coping skills for families, I would say, starts with the parents. So when it comes to that, be sure to give yourself some grace and mercy. Drop and change expectations. Like Aria voiced, you're holding so many hats in your hand. So to also have the same expectation that you're able to give the same output as you would as if you did prior to COVID-19 may not be as realistic, and that's okay. Give yourself some grace. Also take some personal time, manage, process, and deal with the emotions that arise by engaging in some self-care strategies and taking yourself to feed into your mental needs, your physical needs, your spiritual needs, your social needs. Take the time to make sure that all those pieces of yourself are being filled. In addition, limit media contact. There's a lot going on, there's a lot of information out there, there's a lot that may be adding to the emotional weariness that you may be feeling. So feel free to take a break. It's okay. And lastly, you can't take care of others until you first take care of yourself. So parents, please take care of yourself. For self-care from parents to your children. Again, with all that's happening in the world on our island, take time out to let your child know that you love them. Take time out to hear what's going on in their lives, hear about their emotions. Actively listen to how they're doing, actively listen to how they're feeling. Do your best to manage your child's environment by setting clear expectations and a daily routine, and manage your expectations for them as well. They're also going through this. They're also adjusting and trying to understand. Lastly, remember that they are emotionally impacted by all this that's going on, and you are their number one role model. So how you cope, deal, and process definitely sets a trend as to how they can then cope, deal, and process with emotions as well. And lastly, for my kids, what you can do is engage in activities that make you happy. Coping for kids is mainly giving them the ability to slow down enough to clear their cognitive processing. So engage them in coloring activities. Outside walks or games, I'm sure they'll love it. Journaling and art is also a great way to get those emotions out. And also you can use some deep breathing and mindfulness activities as well.
Thank you, Rishee, for those fabulous tips for parents and children. And then to hone in even more on, as adults, what does that self-care look like? We're going to turn to Gemma again.
I think Rishee's list was great for adults too. I think that was a great list of fun things to do. I mean, I would add to that I think, as I spoke about before, one of the things that happens with the threat system is that when you've got that threat system activated, it can be really difficult to bring your central nervous system down and come to a more baseline level. And so it's really important at the moment that people that are suffering with stress and anxiety or depression are investing in activities that put them in a different state, in a different emotional state. So that might be doing adult colouring or singing or dancing or doing something that brings joy. But it might also be really making the time for journaling, maybe about difficult feelings that are going on, talking to people about your feelings, normalizing and being compassionate to yourself and your family, just as Rishee said, about what's going on right now and how difficult that can be. And I think it's difficult to capture just the breadth of what everyone is experiencing. So, for a lot of people, it really is a challenge about adapting to change and being creative and resilient. So I think doing a sort of review of what is in your toolkit of resilience and thinking about how you can add to that in some way, whether there's any areas of your toolkit that are weaker, or where things are working for you and where you can build on that. I understand that for some people there will be a lot of uncertainty about the future and a lot of anxiety about what might be laying ahead for them. And I think for them, I would advise you to sort of focus on what's in your control right now. There will be a lot of things for people at the moment that are not in their control. There's a lot of uncertainty. So really focusing on what you can do and what is in your control, what you're capable of managing right now, and investing your energy there.
Thank you, Gemma. And what a great reminder that just because we think that these are really great things for our kids to do to cope, we can do the same things to bring us joy and remember what is within our control and not. So thank you for that. And so with that, I would like to go to Tawanna to add some tips as well.
Sure. I'd like to add some tips for our couples and some tips for our carers if I can. First of all, with couples, schedule quality time together. Have fun, laugh, and be creative. Go on a date with each other. And when I say be creative, there really are, Bermuda is a very beautiful place, and there are just being outdoors and taking advantage of the outside to nurture each other in your relationship is really quite positive. choose your battles with your loved one, with your spouse, because you can't argue about everything. And maybe the dishes need to stay in the sink for an extra night. Maybe the socks need to remain on the floor. Or maybe the hairbrush needs to be, or the makeup on the bathroom sink. That's okay. It's not going to break your relationship, and it's okay to choose your battles. I also think that couples really should have a sacred space, and that's a space where you don't argue with each other. Ideally, it would be helpful if that sacred space is your bedroom, but it doesn't have to be. So that means that if you are really, there's a lot of tension in the household, take that time, go to your bedroom. Don't use it as a place to argue. Don't use it as a place to be mad with each other, and nurture each other in that sacred space. And of course, the thing that might be a little bit taboo for people to talk about, but I'm going to raise it, is be realistic about sex and sexual intimacy. Because at this time during COVID, we may have challenges. We may not wish to be sexually intimate, and we really have to remember that there are many different forms of intimacy. Sexual intimacy is only one form. For example, one of the things that we normally ask couples to do when we are assisting them with some of the issues that they may face is we encourage them to look in each other's eyes. Just spend time looking in your loved one's eyes, because that really does, and that silence helps you to see into their soul. You can see the hurt, you can see the pain, but you can also see the happiness, the love, and the care that you have for each other. I want to also highlight for those of us who love to follow research that I was reading some research the other day, and it gave some very positive news. It said that 6 in 10 couples reported that COVID-19 had actually strengthened their relationship. And I think that's a real positive thing to remember. Now, with respect to our carers, if you're caring for someone who's diagnosed with a condition such as depression or anxiety, be patient with them, be kind, and remember that talking is only one form of communication. If you're caring for someone with COVID, spend only short intervals of time with them and use signals to indicate whether they are safe. You may read to them or talk to them because your voice may be very soothing as they're going through a very anxious time. Be kind to yourself and don't dwell on mistakes that you make. We are all human. And I think I heard other panelists talk about focusing on self-care. Make sure you get lots of rest and surround yourself with positive people all the time to strengthen you and your role in caring. I'd also like to talk a little bit about our resources, but I'll come back to that, Sandy, if I can, a little bit later. Thanks.
Yes, thank you, Tawanna. I think that the tip about having a sacred space in our homes where we're not allowed to dwell on mistakes or argue with ourselves even or others is such a beautiful thing to have, and it certainly feels like a must right now. And whether that is inside the home on your porch or in the garden or somewhere sort of that you can get to easily is such a wonderful tip in addition to all the others. Thank you, Tawanna. And now to Cherita, any tips that you want to share with our audience, please?
Well, Sandy, I think right now when we're looking at substance use, our keywords are mindfulness and awareness. And really, all of the things that have been talked about already as stressors, whether it's financial stress, relationship stress, being working at home and looking after your kids and homeschooling, all of these things are creating stresses for us right now. And we need to be aware of how we're coping. Are we coping by using substances, whether that's illicit substances, alcohol, tobacco? For many of us, just the fact that we're stuck at home right now, we may have noticed that we're using alcohol more, or we may be smoking more, or we may be indulging in illicit substances more. And so we need to be aware of why we're doing these things. And many of the coping strategies listed can be really helpful, whether it's engaging in some self-care activities, going for a walk, engaging in family activities, fun activities, connecting with family and friends, or even reaching out to a support group, which we'll talk about in just a few minutes. I think one thing to really keep in mind right now is that we need to look at moderation within our substance use, particularly if people are noticing they're using more or even using to the same level they may have been using before COVID, if they've had a break, is that people may be at risk of overdose. And then we're looking at a medical emergency. And so we really need to be mindful of, if we're in the midst of a medical emergency, to please reach out and get that help via 911 or going to the emergency room.
Absolutely. Thank you, Cherita. Yeah, those reminders to be self-aware, to be mindful, bring yourself into the present moment so that you know what's going on with you. And the moderation piece is huge. I think food, with everything that families are experiencing right now. So thank you. And so Aria, some tips, please, if you will.
Absolutely. So at EAP, what we would encourage our organizations to acknowledge is that their employees can only do so much. You are one person, a part of one organization, and a part of one household. And for those whose lives may be a little bit more complex, you may be a part of two organizations and two households. So understanding this, it's helpful for those organizations to make allowances in their employees' work schedules or permission to exercise flexi time, so that they can still be efficient parents, devoted caregivers, loving partners, and conscious individuals while meeting the ongoing demands of the workplace. Organizations should acknowledge that navigating through a global pandemic and discovering a new normal is a process that requires time. Also, that this process will bring about a lot of untapped emotions for people. So when you observe someone that you employ who's struggling, feel free to acknowledge them. Have a conversation with them, talk about things with them, check in with them, see how they're feeling. And then refer them to EAP as a resource so that we can support them in managing not only their emotions, but the time that they are spending working for you as well. Thank you, Sandy.
Okay, thank you so much, Aria, for those wonderful reminders of how we as employees and employers should be taking care of each other. And so now one of our final questions for the panelists is, so how do we know when to reach out for help and where do we reach out to? And we'll just have each panelist share a little bit about the organizations that they represent today. So we'll start with Rishee.
So for our parents, if you're noticing that your young person is not functioning as they usually do in the day, if they're seeming more stressed, if they're seeming more lethargic, if just something does not feel quite right, that can be an opportunity for you to reach out. In addition, for yourself, if you're finding that managing behaviors and managing emotions are becoming increasingly hard for you or overwhelming, that is also an opportunity where you can reach out to other resources. Prior to reaching out to specific agencies, there are also some practical resources that you can utilize within our World Wide Web. So you can reach out to centervention.com. They have free resources on social emotional learning for your young person. Also, Plant, Love, Grow. They have great resources and worksheets for the use of anger, anxiety, connecting in community, feelings, and decision making. Lastly, we all love a YouTube. So there's several things on YouTube that you can utilize to manage and begin utilizing mindfulness and deep breathing. If you've tried those things and still things are not working, it's still overwhelming, feel free to reach out. If you're having concerns related to child protection, feel free to reach out to the Department of Child and Family Services. If things aren't that heavy, but they're still heavy a little bit, feel free to reach out to us at the Family Center. You can reach us at 232-1116. Feel free to leave a message just letting them know that you're interested in services and you would like to have a screening conducted. And you can also email us at info@tfc.bm.
Thank you so much, Rishee. And Gemma, anything that you want to share with the audience?
Thank you, Sandy. Yeah, I mean, I guess I would reiterate that sense of when to step it up is when you notice there's a significant change in frequency or intensity of those emotions. So perhaps you're more preoccupied, the emotion is more intense. You or others may be noticing quite a change in how you're regulating emotions. When there's an impact on daily functioning, so maybe there's a reduction in self-care, there may be disruptions in appetite, motivation, enjoyment of things, sleep, and maybe social withdrawal. And then there's coping strategies that you're using, maybe if they're more risky than usual, maybe more excessive, things like substance use, as we've talked about, maybe increased patterns of avoidance, maybe even self-harm or suicidal thoughts. That's definitely the time to reach out. Just as Rishee said, I guess there is a kind of staged approach to this. It's about gradually upping your coping strategies and doing what you can. And if you really get to the point where that still isn't really helping, then it's definitely time to reach out. And what's great about coming to see a therapist privately is you can talk about how you expand your coping strategies, how you look at your resilience, and they can help you with that in lots of ways. So I represent Solstice, which is a private therapy organisation that has lots of psychologists and different counsellors there. Their number is 292-3456. And you can email them at info@solstice.bm. There's also plenty of other organisations that have psychologists across Bermuda, and they're probably easy to find on the internet. And the other thing I just wanted to represent, that we do have the government mental health helpline, which is open 9 a.m. till 9 p.m. at the moment, and they have a range of qualified counsellors, social workers, psychologists available to talk to for free to talk through your problems. So that's a great resource that's available at the moment. And obviously there is the MWI crisis line as well, which is a 24-hour crisis line.
Yeah, no, that's okay, Gemma. I
need to give the numbers.
It's a great segue. It's a great segue actually to Tawanna.
No, we're really going, oh.
So that's a great segue to Tawanna. Tawanna, if you can share with us some of the things to look out for and the resources at Mid-Atlantic Wellness Institute.
Absolutely. I'd like to invite the listening audience to actually grab a pen and paper, because I'm about to give a list of telephone numbers. And while I'm allowing the audience to do that, let me just share with you what the examples of the resources that are available that you'll be calling if you call MWI. So first, in our children's services, they've been offering some weekly support to some of our local schools, including our two public high schools, as well as Purvis and Victor Scott, and that's really to reduce anxiety and stress. And they'll be rolling out that service as well to Dame Aria Bean Hope Academy. Our rehab team has been supporting the government's emergency shelter as well as the quarantine facility, and they've been administering and delivering medication in the community for those who require it. We also have a phlebotomist who's been working with our community teams, actually going into the community and drawing blood to support monitoring of medication that people may be taking. And for our community acute services, they've been following up with persons who need that help via telehealth. In our intellectual disability service, for those who may require respite care, they have the day center, New Dimensions, which have been going into the actual group homes, and we have 13 group homes in the community that we service. And we've really been helping those who have intellectual disabilities to learn some skills such as meal preparation. We've also been using a model called Social Stories, which allow us to explain to this population what does it mean to socially distance as a result of COVID, what do all of the rules mean for them. So now that you've grabbed your pen and paper, here are some numbers. If you feel unable to cope, seek help. We are here to support you. So the MWI crisis line number is 249-3370. After hours, you can call 249-3258. The suicide crisis line number is 239-1111. And of course, there are a number of private psychologists, social workers, and counselors in the community. And I would say, if you are going to see them, please make sure that you are going to see someone who is actually registered. There is also the Bermuda Government Emotional Wellness Line, which operates from 9 a.m. to 9 p.m., and that number is 543-1111. Thank you.
Thank you, Tawanna. I bet there was a lot of writing going on. And so, Cherita.
So indeed, if our viewers are worried about their substance consumption and worried that they might be using substances as a coping strategy, you can definitely reach out to Turning Point. And so our telephone number is 239-2038. And upon calling, you'll be connected with a counselor who will speak with you about the options, about what your concerns are. And if you decide to follow through with formal treatment, you'll be given follow-up appointments to commence that service. However, some of our viewers may not feel that a service like Turning Point is right for them. And then there are many community support groups that are still running, and our local recovery groups have done a really great job of turning these into online formats. And so if you go to their website, so for Alcoholics Anonymous, it's aa.bm, and for Narcotics Anonymous, nabermuda.org, and they have a full list of all of their meetings that are now on online platforms. And so that can be a really great way and an effective way for individuals to get recovery support at this time.
Thank you, Cherita. And we'll end with Aria on this question in terms of EAP Bermuda as a resource, and any red flags there that we should be looking out for as employers or employees.
Absolutely, Sandy. Thank you so much. So what we will say at EAP are the red flags is if you are having trouble with your employer-employee relationship, symptoms of that may be increased frustration with work-related tasks, also dealing with overall work-related stress, a decrease in motivation to actually get up and go to those Zoom meetings or make contact with your supervisors, or just be physically present and focused on what it is that you need to do in a work environment. So reaching out to EAP Bermuda, if those are some of the things that you are experiencing, is a simple one-step process. So you can give us a call at 292-9000, or you can email us at info@eap.bm. And our office manager will be happy to set up an appointment with one of our counselors for those persons who are with our member companies. What we also have is some additional resources for the audience. EAP is facilitating Wellness Wednesday webinars under the sponsorship of Argus Bermuda, and they occur each Wednesday for the month of June from 12 until 1 p.m. We just completed one today on budgeting basics. Next week, which is June 10th, we're going to be looking at navigating change with emotional intelligence. The following week, we will discuss couples dynamics. And for the final Wednesday in June, our topic will be parent-child dynamics. In addition to that, next month, for the month of July, we will roll out a new series called Ask the Expert. With this series, participants will have one-to-one contact, Q&A style, with various professionals throughout a variety of fields. So in response to those people who are not with EAP member companies, feel free to sign up for our webinars or our Ask the Expert series. It's definitely going to be important to make sure that you're getting great information to help you navigate during this time. Sandy?
Fantastic, thank you. So we're just going to end with one last question, and that is to each panelist. If they could say one thing to the listening audience tonight, what would that be? So we'll start with Rishee again.
First, Sandy, I'd really like to thank you so much for this opportunity to be on this panel today. What I'd like to leave with my audience is each one of us were born with power, privilege, and oppression. How we experience each of these characteristics is based on how we decide to use them. As a community, as an island, as a family, I challenge each one of us to use our power to empower, our privilege to unite and uplift, so that we decrease and take hold of the oppressions around us. Thank you.
Thank you, Rishee. And so, Gemma, any last thought?
Yes, thank you, Sandy, and thank you again for having me on the panel today. Yes, my last thought is just actually a quote, which is from James Dean, which is, "I can't change the direction of the wind, but I can adjust the sails." And I think that really does capture how much we are digging deep in terms of our resilience right now, to think about what is in our control, what are we capable of during these difficult times.
Thank you, Gemma. And Tawanna.
Thank you, Sandy. Before I give my final statement, I wonder if you'll indulge me one more time this evening. And I'd say this: If you are passionate about helping others, mental health care needs you, please, please, please check our website for jobs. If you wish to help financially support mental health, please consider giving to the Bermuda Hospital's Charitable Foundation. And to our staff at MWI, I really want to say thank you, because you have come in to care for our most vulnerable populations, even when sometimes you have been anxious yourselves, and we really appreciate you being on the front lines. And finally, to our listening audience, I say, mental health is about moments of joy. Look for those moments in every action that you have and cherish them. Thank you for having me.
Thank you, Tawanna. Any last thoughts, Cherita?
So my take home, what I hope viewers take away from this experience, is that if you are concerned about your own use of substances or family members' use of substances, please reach out for support. There is effective and confidential help available, and we hold no judgments, and it's there for you to utilize. Thank you.
Thank you. And Aria, last thoughts, please.
Yes, Sandy, again, being the last person to speak this evening, thank you so much for allowing me to be a part of the panel this evening. And it has been a truly awakening experience, as I've gotten just as much information as I'm sure the audience has. So what I'd like to leave the audience with this evening is a statement that will hopefully incite a change in mindset during this pandemic. We are not working from home, we are at home working. The best thing that organizations can do for their employees is, number one, recognize that they are human. And number two, to give them access to information that helps them grow and develop through resources and agencies like EAP. As we're all looking to create a better work-life balance, that is something that can be explored from a personal standpoint and an organizational standpoint, because at the end of the day, a happier, emotionally healthier employee is a better employee, and that leads to a happier and healthier employer. Thank you.
Thank you. So I want to thank all of our panelists tonight for sharing their expertise with us. And I'd like to remind the audience that you are not alone. Hopefully you heard something tonight that resonated with you, or a tip that you can now do, or something that reminded you why you may need to reach out for help. Despite the change and upheaval at this time, we can do things to help us to get through every day, to build resilience and to experience healing. If you need help, please reach out to these various agencies represented here today, and there will be a resource information sheet that will be posted on Family Center's website, www.tfc.bm, with more detailed information on how to contact all of us in case you didn't get that pen and paper fast enough for those phone numbers. We will also be hosting a watch party on our Family Center Facebook page where this discussion can be viewed again, and there will be time for a live question and answer session with all of these amazing panelists. We will advertise when that date will be on Family Center's website, Family Center's Facebook page, and our other social media forums. Please look out for that. Thank you for your time, Bermuda, and have a good night. Good evening, Bermuda, and welcome to this very special panel. Welcome to our listening audience this evening, and thank you for remaining online during this live Q&A portion of the panel discussion. I want to again welcome our esteemed panelists who are here to respond to your mental health questions. You can pop a question into the Facebook chat or confidentially email us at info@tfc.bm and know that your question will come to this group. I will put each question to a panelist without names attached, and the panelists can respond to that question and also jump in with information that they want to add to each other. Okay, so let's begin with the first question. So we've already had a question into the chat, and this is from a teacher who is asking, do any of the organizations offer group mental health sessions for younger children and teens within the school setting? So Tawanna, if you'd like to respond to that first.
Sure. Good evening, Sandy, and good evening to our listening audience. Child and Adolescent Services here at MWI can offer group sessions for various schools. In fact, we do have a few partnerships that have already been established. Please give us a call at 239-6344, and we can assist with whatever your needs might be.
Good evening, everyone. I'd also like to echo Mrs. Wedderburn's response in regards to Family Center also being able to offer school-based sessions and groups for the students. What we would recommend is that the school counselor would reach out to our organization and just identify what some of their needs are and topics that they would like us to present and support their young people on. And we would definitely coordinate with them to come up with an interactive and engaging activity for us to provide to their youth. You can reach out to us at Family Center at 232-1116, or you can email us at info@familycenter.bm.
Hi, good evening, everyone. And just to add to what my colleagues have said is that Solstice actually offer a range of groups and individual treatment for children and adolescents. At the moment, most of them are in our office, but we're able to work creatively with different organizations, including schools, to think about how we could deliver that in schools. So if you wanted to give us a call about that, we're on 292-3456. Thank you.
Okay. Wonderful. If also Tawanna and Rishee and Gemma, if you can also speak to whether there's a cost for that for schools. So if they were to reach out to you, if you can just let us know of any cost attachments to that.
At MWI,
anybody can go ahead.
Sure. At MWI, there are no costs to access those services. So by all means, please feel free to call at any time.
I would like to echo the same sentiment. As far as I'm aware, we do like to provide the best for our community and meeting them where they are. So usually there are no costs associated with them. However, in the case that that changes in the future, you would definitely be made known of that ahead of
time. And at Solstice, the costs, it's very difficult for me to give a direct answer to that because the costs vary depending on what groups or what treatment you're looking at. There probably would be a cost associated with schools, but that would probably be customized depending on what's required. But just to make people aware that there is some financial aid for people where they can't afford services at Solstice. So that just requires you to apply for Cert and provide some details about why you require financial aid.
Okay, wonderful. Thank you. The next question I have is actually for Cherita Rayner at MWI. And so just today, I did hear a question in an earlier meeting that I was in about what services are out there for individuals who are wanting treatment for addictions, various addictions, and they prefer one-on-one contact. So is there anything that you can share about services on the island that are currently able to provide person-to-person contact, and of course, I'm sure within the safety guidelines that the government is currently prescribing?
Sure, thank you. So definitely, as the country has moved through its phases, we have seen a change in how services are being provided. At the moment, Turning Point is able to provide some one-on-one sessions, face-to-face, of course, using the appropriate hand hygiene, social distancing, and the appropriate use of wearing masks. And we are also still providing services through telemedicine, whether that's via telephone or video conferencing means. So definitely individuals can reach out and call Turning Point Services. Our number is 239-2038, and they can speak with a counselor around having an intake and engaging.
Wonderful, thank you. Another question that has been on people's minds, and I've heard a lot about, I'd love to put to yourself, Aria, from EAP, and that is, what advice can you give to employees who are really enjoying this work from home model, but their job is requiring them to go back to work, whether that was even in phase 2, phase 3, etc. So is there any advice that you can give to adults who might be struggling with this now next readjustment to go back to the workplace?
Absolutely, Sandy. I think one of the first things that I will share is that I'm one of them. I am definitely one of those people who are starting to experience the anxieties attached with the transition back into the work environment from being at home. There are a lot of things that we have found comfortable about our home environments. The fact that we're able to be with our kids, the fact that we're able to be with our significant others, the fact that, you know, maybe we wake up at 8:30 because we make 9 o'clock, the fact that we're able to utilize Zoom meetings and teleconferences and different things like that, which have made us become quite comfortable and quite, I guess I'd say, used to being able to work from home. But the reality is that just like how we transitioned to home, at some point, our employers are going to require us to transition back into the work environment. So my advice at that time would be to think about the things that you enjoyed most about working at home, and try to have conversations with your employer about how you can creatively involve those things or incorporate those things into your work environment. So let's say, for example, you are required to be at work every day from 9 until 5. When you're working from home due to the shelter in place or due to the quarantine or for whatever reason, you know, you wake up at 8:30 and you make 9 o'clock. So maybe a conversation can be had with your employer about flexi hours and the fact that you can still wake up at 8:30, you still have that time with your children in the morning, you're getting them ready, you can sit down and have breakfast, get them to school on time or get them to their summer activities on time, but you can come into the office just a little bit later so you can still enjoy those aspects of still being in the home environment. Or maybe it's that you enjoyed the fact that throughout your workday, you could schedule your breaks as you needed them. It wasn't so set that you had to have your coffee break at 10:15 and you had to take your lunch break between 1 and 2 or 12 and 1. Also having conversations about being able to have flexi time in terms of breaks as well. So when you look at how you're able to take all of those things that you enjoy about your home environment and start to incorporate them in the work environment, it gets to a point to where, as once you finally do find yourself back in a physical building, you know, answering the phone, attending to Zoom meetings, meeting with clients one-on-one, or whatever your work environment requires, that you can make that environment just as comfortable as you were when you were working from home.
Wonderful. Thank you so much. It sounds like you've got, hopefully people were taking notes of all the things that they can now have as part of a conversation with the supervisor or manager or employer in terms of just making that readjustment just that little bit easier and people feeling in control, a little bit more in control of the readjustment as well. So, and you talked about children returning to school, etc. So this next question actually goes to Rishee. Rishee, as parents are possibly preparing their children to go to summer camps, and even the idea of what will going back to school in September look like? Will it be mostly physical school, you know, go in-person schooling? Will it be a hybrid, etc.? Is there any advice that you can give to parents on how to talk to their children if they are feeling anxious about going to other places with other children, with new adults, especially when the word safe has really been associated to being at home during the pandemic?
Sure. One thing that comes to mind is that anxiety and nervousness usually comes from the unknown, not knowing what to expect, not knowing what's going to happen, not knowing what's out there. So the best thing that I can tell you to do is have those conversations with a young person. As much information as you know, give that to them. Information that we have about the importance of social distancing, the information we have about washing hands, the information that we have about being able to communicate your thoughts and feelings to safe and trusted adults, being able to have those conversations ahead of time. So if they're feeling nervous, who is that person that they can talk to within their camp? Who's that staff member that they can talk to in their school to voice their concerns to? And also kind of giving them as much information as you know as to how to prepare for the day ahead of them, how to prepare for the transition, and how safe is not only just a home where they are, but safe is knowing that you have someone who will listen to them, you have someone who takes their thoughts and feelings into consideration and that they're important, who will support them through it. So just extending safe outside of a building, but also transitioning it to a specific person or individual that they identify in both home, school, and camp.
I love it. So you go from a safe home, though, to having a safe person associated to wherever you're going to go. Fantastic. Yes. Thank you. Thank you. Okay, another topic that has had a lot of conversation and questions is on relationships and couples. Tawanna, you spoke to this quite a bit during our panel in terms of just couples being real about what challenges they may have been experiencing from shelter in place and probably then through the phases, and even the strengths that they use to overcome those. So is there any advice that you would give to couples if they're sort of questioning, do we remain together? You know, what should we do? And maybe they haven't talked to anybody else yet other than to each other about this, or maybe they haven't even discussed this with their partner. Is there any advice that you can give in that area?
Sure, Sandy. Before I actually give that advice, I think it is helpful for people to understand that actually over the last 10 years, Bermuda has seen fewer divorces than we did, say, back in 2009. And I think that is encouraging news. We also know that those persons who are divorcing the most are aged 25 to 29 years old. And the primary reason for divorce is unreasonable behavior. So the first thing that I would say is understand that you are not alone. There is support. There are family, there are friends, and then there are agencies such as EAP. There are private organizations such as Solstice and others, and the Family Center represented here, that can provide that support. And most definitely, there are public sector organizations such as MWI that can assist. Secondly, be silent for a moment and pause, because a lot of times when we are contemplating leaving our partner, it's because there's a lot of hurt and pain that is driving that decision. And by actually being silent and pausing for a moment, it helps us to really think about, is this something that we want to do? I would also encourage couples who are contemplating leaving their relationships to write down the reasons for that. By writing things down, it helps to make our thought processing very objective. What do you love about your partner? Write that down. What do you love about yourself in the relationship with your partner? And what do you wish was different? But more importantly, what can you do to improve within the relationship? Because sometimes we do a lot of blaming, and it's really a great time for a bit of self-reflection. I said this, I think, during the interview itself. Be kind to one another. And so if you really do decide that you want to leave this relationship, then be kind in that process. And sometimes that might mean responding to your partner, being courteous, not bad-mouthing them, and communicating important information about dissolving your relationship. And most importantly, do not feel as if you have to make a decision right away. Take your time and give it some thought. And as I said, helping to write things down a little bit and talking to others can sometimes make that journey of making a decision much easier.
Wonderful. Thank you. So really slowing that process down. And in addition to maybe pondering about the things that you can no longer tolerate about the other person, self-reflect. What are the things within your control? What are the things that you can change? What are the things that need to be worked on? So thank you for that. We have another audience
Sandy,
question.
If you wouldn't mind me just jumping on
Sure.
the end of that, if I may. Because Ms. Wedderburn mentioned EAP, I just wanted to kind of insert the services that we have available for couples who are having the difficult time kind of processing their relationships and what they're going through. EAP does offer couples counseling services. You can reach out to us at 292-9000 and also email us at info@eap.bm. Also, in the event that you are with a partner who is not willing to engage in couples counseling services at that time, that does not mean that you can't come on your own. In terms of self-reflection, we can assist in that process. We can help with, writing down things and looking at the pros and cons of the relationship, reasons why you should stay, reasons why things may not be necessarily desirable for you at that time. If you are in need of just someone to kind of support you through thinking about all of this and being able to make the best decision, not only for you as an individual, but for you and your partner as a couple moving forward, we do have the option to provide those individual services. And who knows, maybe in time you can get to a point where you can approach your significant other about the couples counseling. You can talk about what it is that you've been getting out of it as an individual and how beneficial it's been to you, what that self-exploration has looked like, and the types of things that you have learned. We can talk about things like having different love languages, different communication styles, and how all of those different aspects support building a very strong and comfortable relationship moving forward. Thank you.
Wonderful. And I thank you so much. And I think it's also a good time to even address the myth that in couples counseling, that the counselor will ultimately take a side. And really the job of a counselor, therapist, whoever it is delivering couples counseling is to take the side of the couple, is to really, be there in a very neutral way for both persons, that both persons feel supported through the process, that it feels genuine and authentic. So, yeah, that's just a myth. We want to make sure that we quash that. There's also a question here. I'm just trying to pull it back up for Cherita. Make sure. Okay, so Cherita, there's a question from the audience about when will Turning Point offer inpatient detox that is not on Summers ward? It's a very specific question.
Very, very specific, and I don't have an answer, unfortunately. I don't have a definite answer again. It's related to how the country moves through the phases and how the organization moves through its pandemic phases. So unfortunately, I'm not able to give an answer to that at the moment.
Okay, so I guess I would ask, is there a good way to find the information once MWI also moves through the phases, so that somebody looking for this specific information, is that posted somewhere, maybe on the Bermuda Hospitals Board site or something like that, so that they know when to expect a response?
So definitely our PR department does a really good job of sharing with the media the different ways in which the services are opening up across the organization. So that's definitely one way of looking at the BHB pages, whether it's the web page or the Facebook page, and definitely with local media. And then individuals can contact Turning Point directly to speak with a counselor or our clinical manager to identify that step process regarding inpatient detox.
Okay, great. Okay, so the next question is from Gemma at Solstice. So Gemma, what would you say to adults who maybe have never given therapy a try? The pandemic we're moving through the phases, and all of a sudden they are having all of those symptoms, or some of them even, that you described in the panel. So now they're feeling a bit anxious. They're waking up, the butterflies are in the stomach. Maybe they're not sleeping well. They're not eating well. Maybe they're less tolerant of their children's frustrations, etc. So what would you say to an adult who's maybe never given therapy a chance before, and they may feel like calling someone for therapy means I'm a failure, I've done something wrong, I can't handle life? What advice would you give?
Yeah, I mean, for starters, therapy definitely isn't a failure by any stretch of the imagination. I mean, and I see a lot of young people now that come for like an annual wellness check, as if it's their annual physical, which is, I think, is a great way, a great representation of mental health being sort of destigmatized in younger people, which is wonderful. I think it's, what's great about therapy is it gives you a fresh set of eyes on a situation. Just as our other panelists have said, it's a great way of just kind of slowing things down and thinking about all the different ingredients in your life and how they're working out for you, and what tweaks you can make. It's not always about a massive change. It's sometimes just about tweaking things in a way that gives you more breathing room. It gives you a more of a sense of control, or gives you more of a sense of hope. So certainly I don't think there's no kind of cutoff. It doesn't have to be bad for you to come in. You know, you can just say, actually, there's scope for improvement here, or maybe someone can help me think about this in a different way. Certainly one of the things we'd say is, we know that people are going to be struggling right now. We know that it's pretty common for people to be having kind of low key struggles or on and off struggles. And I guess, you know, that doesn't mean you have to rush in to see a counsellor or a therapist. However, what we do know, particularly about depression and anxiety and stress, is that it can unfortunately have a bit of a snowball domino type effect, that, you know, once one thing starts going wrong, it has knock-on effects in other areas of your life. For example, just, you know, basic one is sleep. You know, once you start losing sleep, the consequences of that can be very fast and very catastrophic. So, you know, I think just thinking about being proactive in seeking therapy is a great idea. You know, it's much easier to seek therapy and start to build coping strategies in quickly than it is to deal with a situation when things have really gone wrong in lots of areas of your life. So much better to be preventative than to be trying to pick up the pieces when things have gone wrong.
Yeah, fantastic advice. And I think the comment as well about sleep is definitely not an insignificant one, in that, you know, I remember reading an article that reminded me about all of the neurons in the brain, and those are really our nerve pulses in the brain that actually come together when we're learning, create memories, and that if you do not get enough sleep, that those die off. And I remember reading the article, and it was probably close to midnight, and it even said, if you're reading this article too late, you need to put this down and go to sleep. So it's just that reminder that sleeping, eating right, exercising, reaching out for help before the snowball effect takes place. And as I look around, and each of you sort of reminding me of a particular area, whether you're in a relationship, whether it's between you and your employer or supervisor or manager, whether you are struggling with an addiction or a mental health concern, or as a parent, you're feeling like you're losing control over sort of keeping your family together, that it is a good time to call somebody for help. And I know that we do have everybody who is on this panel, their organization information is actually listed on Family Center's website. And we also have everybody's names again on our Facebook page. And therefore, if you just need to look up by name, and I know that everybody on here as well has their own organizational webpage and other social media platforms. So is there anything that any of you would like to leave with the audience? I know we did that at the end of the panel discussion. Is there anything at all, sort of that thought that you might have even ended the panel discussion with, that I wish I had said that? So I just open it up to the panelists to just add any concluding thought that you would like to leave with our listening audience.
I don't mind starting that, Sandy. I think at this point where we are looking at exactly what we talked about before, we are now in phase 3 and phase 3B, and looking to start phase 4, I believe, on July 1st, or when the press conference reveals that we will do so. I don't want to jump the gun. We are going to be looking at wearing the hat of an employee again while you are in your actual office environment. And to really just allow yourself the time and to be patient with yourself. Just like it was a process to kind of transition from the office environment to home. And there was a bit of a, flexi period and a transition period and a kind of getting comfortable with what that was going to feel like and look like in your home environment. We're going to have to expect that same transitional period for when we go back into the office. So for employers, have a little bit of lenience with employees as they start to come back into the office. We're going to look at people who are still individuals, as I talked about in the mental health panel, still trying to manage relationships, still trying to manage childcare. Schools are out at this point. So we're looking at different activities, whether or not you can get your kids into camp and what that's going to look like. And I think just as long as a little bit of consideration is given from both ends in terms of patience and flexibility, it won't be as difficult and it won't be as worrisome as people are starting to feel. It's definitely one of those things that if we just take a little bit of time and a little bit of care, it can be successful for both employer and employee.
Wonderful. Thank you. Hopefully that helps to just reduce that anxiety for people who are thinking about that. What does that readjustment look like? Appreciate that. Yep.
I don't mind going next. I believe my parting words to our listening audience or viewing audience would be to be kind to yourself. And as Aria said, we are now progressing through changes and now having to readapt to things we might have left behind, and to keep in mind that reaching out for help and support is okay, and that there are services available to provide that help and support.
Yeah, absolutely. And even more than okay, right? So you're echoing Gemma's words in terms, this is prevention before this becomes really feeling out of control, which is a feeling, to reach out and call for help. And there's no judgment there. This is why we do this. There is no judgment. Every person who's in this profession is there to care for the person that is approaching them for help. So appreciate that reminder.
Thank you.
My follow-up sentiments would be just in echoing my panelists to extend that same grace to yourself, extend that same grace to your young person. They're adjusting as well. They've probably been inside for much longer than they would have liked to be. So their wiggles are there, their anxiety to get out and about is there. All of that is there. So look at your expectations of your young person, reshape them, reevaluate them, and start to cater them to where they are now and not where they were before the pandemic, because I'm pretty sure you have maybe a different kid than you had before the pandemic occurred. So just have that grace with them and have that grace with yourself. Readjust your home structure and schedule if need be. If bath comes in the morning, that's okay. If dinner's a little later, that's okay. Have those conversations with your young person. Know what they're feeling, understand what you're needing for yourself, check in with yourself. What are you needing to give to your young person? And then together come up with a plan as a way to move forward. So be kind to yourself, be kind to your young person, and set new realistic expectations on how we're moving forward with all of this adjustment.
Wonderful. I'm sure that's music to children's ears. Can we set new realistic expectations, please? I'm sure you're a favorite in the household now for children, Rishee. Okay, Tawanna or Gemma, any final words?
Sure. I will say to our couples particularly, you are human. That means you will make mistakes. But it also means that there are some phenomenal opportunities for joy in your relationship. And as I mentioned before, discover that joy, create that joy, and look for those little moments, because people are getting married according to our statistics, and fewer people are getting divorced according to our statistics. Therefore, recognize the phenomenal opportunity we have in front of us.
Wonderful. And I really appreciate that reminder of joy, Tawanna. That has really stayed with me from when we actually first filmed the mental health panel, when you said, I think of mental health as joy, when mostly if you ask somebody what comes to mind when we say mental health, they may spit out the words anxiety, depression, sadness, frustration, anger, addiction, etc. And I really like how you flip that, but rather it is about joy, and how do you regain that in your life, particularly when you feel like it's lacking, and that is showing up in multiple areas. That's time to call for help. So I appreciate that reframe. That's great.
And on the back of that, I suppose I'm thinking about a lot of people that I know just personally that and just from speaking to people that this is such a novel situation that we're talking about things like depression, anxiety, stress. But actually, I think for a lot of people, they just feel out of sorts. They're uncertain. They don't really know. Things are different and they don't quite know what to make of it. And I guess, normalizing that, talking to people about it, finding familiarity, comfort in familiarity, I guess, anchoring in things that are familiar and structured, and looking after yourself that way. Because I guess for a lot of people, I suspect they won't be able to pin it down to exact feelings or words or things that are very clear to explain to others. There's just this sense of things being a bit off or not right, and that's valid too. You know, that's important to talk about too, because it is a strange time and it's a strange adjustment for everyone. And, you know, none of us have a roadmap for this. So, you know, just normalizing that and supporting each other with that.
Yeah, I love that reminder of being ground yourself first when you're stressed. And you know, I think actually what you just said is making me think about how we probably adjusted quite quickly to working from home or being at home initially because it's familiar. It's grounding. And so if there's anywhere we needed to be when we went into shelter in place, that was home and not in a bunker or a basement somewhere, as in other you know, world situations that have resulted in people needing to sort of, you know, hunker down. So yeah, that definitely makes sense. And for everybody who's really enjoying the working from home model, it's because it does feel grounding, familiar. You feel in control of your space, your environment, and for all the reasons that Aria had actually described earlier. So with that, I'm just going to end off with a thank you to all of you again for your wonderful participation in the panel and in this live Q&A. Certainly Family Center could not do this without each and every single one of you. I thank you for the service that you provide to our community and to individuals in their most vulnerable states of time when they're calling out and asking for help. And a reminder today is don't allow yourself to feel so vulnerable before you call for help. So thank you also to the audience. Really appreciate your questions and for tuning in either when you have watched it on Channel 9 on BBC, the few times it's been aired, or this evening. And with that, good night, Bermuda.
Good night.